Hello, everyone. Welcome to this special election edition of News Now. I'm Roger Colton. Between now and Election Day on April 6th, Franklin Tucker and I will be interviewing candidates in townwide elections. Today, Franklin and I welcome Dr. Adrienne Allen, who is a candidate for Belmont's Board of Health. Franklin, let's get started. You've got the first question.
Okay. Adrian, you are a doctor of internal medicine, and you've done a lot of research in terms of the importance of communication between physicians and their patients, or physicians and their pharmacists. Can you tell me a little bit about what you would bring to the Board of Health in terms of communicating?
You know, what I do every day is communicating, both in my role as a physician, also as my role as medical director for a large practice on the North Shore. And the last year really tested that for everybody, because I had to communicate and lead in a time of crisis, in a time of uncertainty, while still trying to provide safe care for our patients, at the same time protecting our physicians for being safe. And so what I have to do every day is take national guidelines, take where there are no guidelines and try to get consensus and distill that down to what are the take homes in everyday use for my practices. And I can bring that same know-how to the board. The other large piece of my job as both a primary care doctor and a medical director is to advocate. And so I spend a lot of my time hearing what's the rock in people's shoes, what are unmet needs, what are things that need to be set up so that we can deliver the health care that they need in my daily job. And so at the Board of Health, what I would hope to do is listen to people at Belmont. What do we need? What do we need to be healthy as a community? And then how do we collaborate with other groups in Belmont? How do we raise awareness? How do we shine a light on those needs and to bring those sides together?
Adrian, I've heard you say that your decision to pursue this candidacy has not been or isn't driven by any criticism of Belmont's response to COVID-19. Given that, how does COVID-19 fit into how you would do your job duties on this commission?
I think it's hard to talk about anything health without COVID-19. And when talking about COVID-19, you know, I don't have any criticism for the Board of Health. I think they've done a great job. What COVID-19 has done for all of us, and particularly those in healthcare, is to shed light on the structural challenges within the entire American healthcare system, within our state as well. And so it gave a lot of us pause to say, how do we become more engaged? How can I become more engaged to create the health care system at work, and also to create a healthy community at home that I would like to see? So COVID-19 really informs that. It really shed that light. I think directly, a lot of people ask, when is COVID going to be over? You know, a big question in my job right now is, when are we back to normal? And you know, that's a question I'm trying to answer every day at work. No one has that answer, but what I can say is it will probably ebb and flow for the next few years, hopefully 6 months, maybe longer. And what I can bring and why I'm looking to run is I can help adjust through varying guidelines. I can help say, how do we straddle the changing knowledge, the changing fields, the changing needs as we enter this post-pandemic world?
Now, the Health Board is the Board of Health is the policymaking and rulemaking board. It's not you're not going to be going out there and doing restaurant inspections or anything like that. What is one area of public health that you'd like to promote besides COVID? Something that would really affect the public health of residents in Belmont.
It's interesting that you say that the health board is a policymaking and rule making, and I think it is, and that's foundational. It really has to be there. Why I'm running is to go from regulation to aspiration. And so not to say that the board has to be out there on the front lines fixing everybody's health. That's not it. It's how do we generate conversation in the community and look at issues facing Belmont from a health lens. What is the health perspective? How does decisions we make affect health? So that said, as we look at the policies and procedures, health equity is a big issue, right? The health effects of structural racism cannot be ignored. They've been ignored for too long. And from the unequal deaths of COVID-19 and the horrific racial violence we've seen this year, both nationally and in our town, I think what's first and foremost is to review our policies, review our regulations, not from my lens, but from lens of other people to say, are these equitable? Is this what we need? And how can we do this in a better way? So that's first and foremost. Second is climate change, right? We're seeing this pandemic now, which likely has a climate relation. As we encroach into forests, as we encroach into other areas, we're going to see more diseases. Climate change is the greatest health threat facing our country today, from vector-borne illnesses to worsening air pollution as air rises, worsening air pollution as the heat of our daily temperature rises. It holds more particulate matter. From food insecurity, as it gets hotter, we're going to have droughts. The nutritional value of food decreases. From hurricanes and other events, we ran out of saline a few years ago because a hurricane hit a plant in Puerto Rico. So what are Belmont's needs in that? How do we educate our residents? What do we do on high heat days? What do we do on snow emergencies? So I think maybe shifting the perspective, and what is our air quality? Like, how are we monitoring it properly as the days get hotter? And how do we protect our vulnerable residents on those hot days so that they're not having lung disease or heart attacks? So those are my priorities: COVID, health effects of racism, and climate change.
Adrienne, in the last couple of years, it seems like not only Belmont, but the Commonwealth of Massachusetts has been hit by a number of public health crises. Obviously, recently was the COVID-19 health crisis. Before that, there was the opioid health crisis. And it seems as though we're always responding. Is that the nature of health crises, is to be put in a responsive posture, or is there a way to foresee and plan for these?
I think it's the nature of how public health is structured in our country, and it's of no fault to Belmont, right? And we have to be realistic. What can Belmont do in the setting of a larger health infrastructure that is underfunded? So when we don't pay attention to the community needs, they will bubble up into a crisis. So it was not a surprise to any of us practicing primary care when the opioid crisis became a crisis. We had been seeing this in our practices trickle in for years and decades. And due to inattention, lack of funding, or lack of mental health resources, it bubbled into a full-blown crisis. And so I'd expect we will see more of that unless there are systemic changes at the state level. Now, what can Belmont do? I mean, that's not within our purview per se to fix the whole country, but what I think we can do is converse among each other and say, what are our needs? What are the things that we're afraid to talk about? What are we struggling with our family's health, the health of our neighbors? And how do we talk about that together? And what can we shed light on and ask for assistance from for the state level and federal level? How do we get the help we need to support our community to be the healthiest it can be?
One area of public health that isn't really talked about, when you talk about public health, like I said, it's like making sure that the restaurants are inspected and things like that. One thing that isn't really talked about in public health is mental health and the mental health of a community. Can you talk a little bit about that and what you would do if you were on the board to do to make that much more awareness?
Yeah, that's an underpinning of everything. And I think within the state, we don't have the resources that are needed to meet the mental health needs of all of our Massachusetts residents. Again, it starts with a needs assessment. Where are people hurting? We're all hurting in COVID, but we're not hurting the same way. It's not distributed equally. What was not attended to before may have gotten worse now. So I think that's the first place. And then it's partnering with other towns other organizations who do it well to say, what can we do together to shed light? What are the needs in our schools? What are the needs for our seniors? What are the needs for working parents? So I think there's support with each other that we can do. And there's also professional services that we may have to explore or not. But the first step is seeing where those needs are, partnering, sharing best practices, and then advocating to our legislator on what we need.
Adrian, you mentioned the word equity a few minutes ago. And in Belmont, there is considerable diversity. We have young people and old people. We have an ethnic diversity. We have a socioeconomic diversity. How does the town, as a town, through the Board of Health, ensure that the public health needs of all the different elements of the community are met?
And that's the first conversation that needs to happen. I wouldn't pretend to know the full answer on how to do that, but I could make some suggestions on what has worked in my practice and as a medical director. And I think trying to figure out how to hear from everyone, right? An email survey may not work for people who don't have computers or an iPhone. We may have to have town halls. We might do a paper mailing. We might set up a booth at a market just to hear what's happening. If you survey 100 people, they may have 100 different views on what's equitable, but themes will emerge inevitably. And I think it's partnering with the leaders in the town. There are a number of groups who are working towards equity, shining a light on racism, and having key stakeholder interviews to see what are they hearing, what needs to happen. And then we look at our policies and we reflect back and enter into a dialogue to say, how can we make these better? That would be my approach.
Franklin, let's come back to you for one last question.
Sure thing. And that is something that is always affecting everybody in town government. One statement public health officials said is, when public health works, we're invisible. And unfortunately, when that's the case, you see budget cuts and underinvestment. What would you do in terms of advocating for health expenses for the town? We're a town that didn't have a social worker for senior citizens, and neither did we have a social worker at the high school. So, what would you do to advocate for public health?
It's an interesting quote. When we are working well, we're invisible. Actually, I think if we're working well, we should be visible. We should be highlighting public health to a degree that it's not highlighted normally. It's hard to say what I think should be there. Again, I think it's what the town thinks, not the town administrators, but the people of the town feel that they need. And certainly my sister's a social worker in mental health. I would love to have a social worker everywhere. We all need someone to talk to. I don't think that's realistic or feasible. But we have to first assess the needs, figure out the gaps, and really advocate for that, because sometimes you have to have upfront cost to have future benefits, although that return on investment at times is hard to argue when you're in a deficit. But that's the dialogue we need to really realistically enter into. So how does having a social worker prevent substance abuse? How does having a social worker save costs down the line in terms of educational needs or other things that we're seeing? So I think it's a dialogue. It starts with the needs assessment, and that's foundational. And then we look into what we can realistically do. And if we can't do, we ask. And if we can't ask, we collaborate with others. We look for grants. We try to figure out how to make things work. I mean, we don't stop advocating for it if the funding is not there. I mean, certainly in primary care where I work at a safety net hospital on North Shore, there's never funding. And so what we do is we look at it. I do lean work and we muster out what we can, but then next fiscal year we bring it back again, and eventually we get traction, right? If it's an important enough issue, that fire won't go away. It will gain traction, but we can't give up on it just because we get that first no. So I'm not here to say we need a position or don't, because I'm not familiar enough with the needs assessment, but let that needs assessment and dialogue inform where we need to keep shining light and keep trying to figure things out. And that's how I would approach that mental health social work issue.
Thank you, Adrian. Thank you, Franklin. We've been speaking today with Adrienne Allen, who is a candidate for the Belmont Board of Health in Belmont's April 6th election. You've been watching a special election edition of News Now. Between now and Election Day, Franklin Tucker, my co-host, and I will be interviewing candidates for townwide office. Thanks again for watching. My name is Roger Colton. I will talk to you again next time.